Welcome back. New tonight, an in-depth report on the recent findings on Tulsans' life expectancy. 2 Works For You reporter Giselle Puente found the rate between North and South Tulsa is alarming.
Taking a listen to your heart.
A long and healthy life.
Hold your breath for a moment.
That's the goal. But for Tulsa residents, your address could make all the difference.
We have still a large disparity, just over 12 years.
The Tulsa Health Department says a baby born in South Tulsa can expect to live 12 years longer than someone born in North Tulsa. Researchers there found the life expectancy in this zip code 74130 is 69 years. 20 miles to the south in zip code 74133, life expectancy is 81 years.
There's really no reason that we should have this inequitable issue of people not being able to live as long as their neighbor.
How are you doing, Miss Long?
Talk to residents up north, and many will tell you they're not surprised.
There's so many people that don't have cars and transportation to get to doctors, and then a lot of them can't afford it.
59-year-old Anthony Long takes care of himself at the Wayman Tisdale Specialty Health Clinic. He says access is a big problem. Long told me he only counts 12 health facilities in North Tulsa he knows.
Which on the south side, everywhere you look there is healthcare.
If you type in a South Tulsa zip code on the map, it's really easy to see just how many healthcare facilities there are in that side of town compared to North Tulsa.
I could see where, yes, that would make a difference for people. But as far as still being healthy, I think there are still other ways to become healthy.
That people are paying more attention to their health.
Health department researchers tell me social or economic issues are the biggest impacts on someone's life expectancy. The department found that people living in North Tulsa, on average, survive on lower incomes and deal with more overcrowding issues than those living in South Tulsa.
So we saw that the more economic burden a community has, the worse their life expectancy.
Solutions have been elusive. The health department is working with the community to come up with a strategic plan. And local health experts say early prevention and awareness are top priorities to close the gap.
We got to be looking at healthcare a totally different way, because we need to be finding patients before they are sick and trying to help them right up front.
And doctors say no matter where you live, you can still exercise in some way, and that will lead to a healthier lifestyle.
I do try and work out at least 3 times a week. As far as like my health, I do go to the doctor at least once a year.
Since I've started taking care of myself, that I feel like I'll live a lot longer than I would have. Because sometimes I feel I should have been gone a long time ago.
All in an effort to keep whittling away at the dirty dozen. In North Tulsa, Giselle Puente, 2 Works For You.
Well, maybe help is on the way. Newly elected Tulsa City Councilor Vanessa Hall Harper says trying to reduce the life expectancy gap is one of the first things on her agenda. She says she'll specifically focus on improving grocery options and applying for a state grant that would go toward improving health in her district.